That's like 90. That's like 112% alcohol with a little eucalyptus oil. Let's keep it going in the K-Wave News Zoom Room. 8:45. Superintendent Jon Fernandez. And John, if we could, if you just want to start by maybe a little reacts to what Dr. Hoa Wen had just said about the situation of the spread in the schools. Or the case positive.
I mean, it's very important, Chris, as you know, to when we talk about this, to use the correct language. And so I'd have to just push back right now and say that there is no spread in the schools.
Right.
We have cases that are being reported at the schools. From what we know at this point are the cases, because they came in the first days of the school year, most likely came from home in the community. We have about 400 cases that are active, right? I think in the community, the latest report, about 400 active cases island-wide, and of those cases, 15 of them are students, which is about 3% of that overall population. But of course, we could expect that, what's happening in the community is going to be reflected in the school system because that's how it goes with everything in the community. If something's happening out there, you're going to see it show up at our doorsteps, in our schools. So the focus and the entire plan that has been developed and put in place is really around rapid response. And so that rapid response means that as soon as we identify a positive case, we have to ensure that we do our job to limit, prevent, contain any spread within the school, within our school setting. So if we were going to talk about spread, that's more likely to look like clusters of cases emanating from one school, one classroom, and so forth. We don't see that at this point. We see 15 cases, separate cases spread out amongst several schools, and each of them, we're still gathering information from the contact tracing to be able to see what else we can say about those cases. But it's different. 15 cases at several schools is different from saying 15 cases at one school. So there's a real need to discern what the data is showing us. So again, we did anticipate the possibility of cases being identified, whether they're employees or students at our schools. And what we've done is executed our plan to address the contacts, students and employees who might need to be quarantined and tested. And then from there, we get a handle on the results, see whether our protective measures are working, and hopefully we don't see further cases emanating from what's actually showing up from home and the community. So that's really what the focus is. And right now, like I said, we don't have any indication of any spread within the schools. What we do have indication of is that what's happening in the community, kids are coming to school with positive, maybe asymptomatic, but through tracing and through other things happening in the community, they're identifying themselves as part of the positive individuals, and their parents are calling, letting us know that, and then we're responding right away. So we're going to need additional time to continue to test and clear employees and students who have been identified in this first round, and then we'll have more to be able to analyze and use to guide our decisions.
How many schools have been impacted by the cases? I'm trying to count it.
Yeah, let me. Let me.
I mean, John, I get what you're saying about the
13 schools.
Right. So we have about 14 schools. We have 13 schools and 15 cases.
Right.
And so what we're doing, right? I mean, we're going to take some time. I think probably the communication on this matter has to be really, expanded, and because it's very difficult, even in our extended conversation here, to kind of talk through the complexity of what's happening and what we're tracking and what we're doing to address. So what we know is we have 15 cases, we have 13 schools. These are most schools have just one case, but we do have a middle school at Ogden and Johnson with 2 cases, and we have Unsalon with 2 cases. What we know is that because we have a case at Attica and we have a case at Unsalon, or at Beneventi, for instance, it's hard to say that those 2 are connected. So we're not looking at this as a mass, as a whole district. We're looking at this on a school by school basis. Highly unlikely that an Attica elementary school student is going to be spreading it to a Truman elementary school student. So those numbers need to be looked at, within their school community. So we are, every JIC report, we update a table of schools, active cases, enrollment, and the percentage of cases that are identified at the school sites. The highest level we've identified is in a smaller school. We've got 0.3%. At Attica, that one case represents about 0.3% of that overall population. Across the district, it's 0.2%, and we're using that percentage to kind of track, whether we're seeing increasing cases, what percentage of the enrollment is being affected, and so forth. The reason we do that is because we know that there may be a certain threshold where we require us to, number one, assess whether in fact there has been a spread, that there are clusters of cases, and that would lead us to a next level of action, meaning, if we have any fear that there is spread within the school, that's going to take more aggressive action than what we're doing right now, including possibly the closure of a school. In other school districts, I know that they've used anywhere from maybe 3 to 5% of the school enrollment being active cases as the sign that that school closure might be necessary. So we're not near that percentage yet, but it is built into our assessment and tracking to monitor on a school by school basis what cases we see, any indication of spread, and when it's time for us to move into a broader strategy to address that risk of spread from students to fellow students or to employees,
right,
and vice versa.
Yeah.
Go ahead.
I mean, I just think it's hard for, and I get what you're saying, John, and calling me out for using the term spread in the schools. I know, but I mean, just from the parent standpoint, right? When they have 14 different schools or whatever, and you get these alerts all the time,
absolutely.
it's like, oh my God, it's everywhere. It's very easy for them to jump to that conclusion.
Well,
right?
it's tough. I'm not calling you out. I just want to say for the community the community standpoint is we use those terms loosely, but one person is going to take that term and say, "Oh my gosh, it's a spread within the school." So, I had a parent at one school just really express concern about the safety of the schools. About the cases at the schools. And I said, "Well, what school do you go to?" And they said, "Well, I go to this school." And I said, "How many did you hear about a positive case at your school? Is there something that we're just learning?" And she said, "Well, no." I said, "Well, okay, we hear you about your general concern, but let's keep our eye on, what's happening at your school to make sure that you guys are safe there, and we'll continue to report out the information." What I think is interesting is that, I know there's a lot of focus on DOE, and like I said, we've got 15 cases. There are 400 out of 400 some active cases. It's 3% of that amount, and yet nobody's talking about where the 97% of these cases are, and we understand that, right? So I think part of it is that we still value transparency. We still value sharing the information with our public, with our stakeholders, to let them know what's happening in our schools and what we're doing about these cases. And we're going to work to really explain our thought process. I think sometimes because we're all scrambling behind the scenes to keep an eye on everything and work with public health and work with the physicians. And, Dr. Wynn and I were on the phone earlier this morning kind of talking through some issues. There's a lot going on with a lot of focus, conversation, collaboration, and urgency around what's happening. And, we don't necessarily want everybody to kind of be in the middle of all those discussions, but we do want to share, our approach so that maybe people can understand better how we're evaluating what's happening in our schools, knowing that, of course, there's a lot of concern about the broader community trends as well. So I just want people to know that we're not sitting back and watching. People are losing sleep. about this on my staff because I've told them, let's keep an eye, monitor, improve, make adjustments, and we need the information as soon as we can so that we can guide our next decisions about what we can do in schools to assure parents and students that the environment is safe enough to continue operating.
John, how many students are quarantined right now, and also teachers and support staff?
Well, we're going to go ahead and provide a more comprehensive, maybe a set of information. I know we're still gathering the latest numbers, but I'm going to have to make put an asterisk near these first week numbers because like I said, I'm just going to tell it like it is. And I told my partners at Public Health, I mean, that's all I got. We, in those first instances with the schools reporting, and this is with Finagazan and Unsalon, for instance, elementary schools, when you get a case and you do contact tracing, you're really talking about one class, right? I mean, they're pretty much in a one classroom the entire day with one teacher, maybe one staff member, and they're supposed, they're moving around the school in cohorts, right? So they eat lunch together, they play at recess together, and so it's easier to identify, who those are that may be potential contacts. Now, we know that close contacts are really supposed to be those who are in close proximity within a certain number of feet for a certain amount of time, 15 minutes of cumulative time together. That would potentially be a close contact. And we normally go through that process of trying to identify, who those individuals would be. But in this early stage, because we just had a couple of days under our belt, what's happening at the schools is really trying to lock down the seating arrangements for every class. So for elementary, it was fine. And I think we took with public health input, maybe took a broader precautionary approach by basically identifying the whole class as contacts, even though, kids may not have been in close proximity, may not have been in contact with the index case at all. And we included the teacher, and for the elementary school, that's one classroom. Now, the next case we had was Untalon, which is a middle school. And for those of you who have middle school students, they don't stay in one classroom. They go from class to class for about 6, maybe 5 to 6 periods a day, and they go to they have 7 teachers and so forth who they interact with. And so at Untalon, because we were already taking that approach early with one school, we took that approach with Untalon, but that meant that whole classes multiplied that number to over 100 students and teachers. And again, my first response was, that doesn't make any sense with regard to what we've been saying about contact tracing. But the response we got was, until we get those seating arrangements locked down, with middle school and high school, you'll see some changes in the classroom schedules and the, changes in classes for those students. They might go from one class to another in those early days when the schedule is being sorted out. And so, I think additional time was recommended to lock down those seating arrangements. And so instead of taking a very, focused approach, acting in, with an abundance of caution, we identified a bigger universe of students and teachers to put in quarantine and test and so forth. That's not something that we can continue. It doesn't align itself with the guidelines. And I think the intent of, taking a very cautious approach to it also raised concern that you had 100 and plus close contacts to the index case when that wasn't the reality. And so, we count that as lessons learned. We've had our conversation with public health. I think we're on the same page. I mean, we have to make sure we follow the guidelines. Otherwise, the mixed messages go out to the community and people say, well, my student was a very close contact. We want to make sure that when we say that, we mean it and it aligns with what we've told our community. So, we're working through that communications and collaboration with public health to make sure we're on the same page and that our stakeholders get good information that doesn't stir up additional panic or concerns, out of something that I know was well intended. And so, so what you're seeing now is a very focused approach. So as we see schools being reported, the number of close contacts are probably around 10 to 12, 10 to 15, versus what we saw early on, where we were taking a broader approach. and identifying students, even if they hadn't been, close to the index case.
So no numbers then.
Yeah, but I mean, like you can guess. I mean, like early on, and I'll have to get the numbers specifically, and we'll produce that. We're hoping today or tomorrow to give an update for the community and provide a comprehensive approach as well. I mean, because I think it's important that people get the big picture and not just the tidbits. And it's hard to do, especially even in an extended interview like this. We want people to understand the big picture. What happened at Unsalon in that first round is not what's happening in other schools. So we don't want people to extrapolate from one instance and say, oh, every time there's going to be an incident, it's hundreds of students and a whole team of teachers. That's not the approach. The approach really is focusing on that close proximity and time frame in alignment with our guidelines. I just think in the first days of school, lots going on. The approach of trying to show that we were, that there's going to be abundance of caution taken, also kind of raised, the anxiety level of the community when it really wasn't the right, an accurate picture of what was going on with that particular case. So as you go forward, when we talk about the close contacts, we are going to see, a smaller group of those who truly are identified as being seated with, interacting with the index case, and we'll go. And the reason why we're doing that is because you identify 120 students. It's going to take you time to go through the testing, quarantine testing, and clearance process. And if they're not at risk, based on the close contact guidelines, then we need to get the results more quickly from those who are directly in close proximity. Let's get those, and then we can move more quickly to respond based on those results.
Okay.
So for instance, I guess one example is if you find a student in the kindergarten class who tests positive, but you're going to go and identify the 6th grade teacher as a close contact, you can understand that you've now taken that 6th grade teacher, put them in quarantine, test them. The results are going to come back. Most likely it's going to be clear because there's no interaction, but it just adds to the number of folks who have to go through that line. So we had a good conversation with public health. I think we're on the same page. We've got to, go back to clarifying the guidelines. We are going to put out a communication to parents to articulate all these various steps so that they're very clear as well, and they have a place to call. I know that our schools have taken a lot of responsibility for answering questions generally, but I think what happens is that if they hear slightly different information at one school versus another, that again causes concern. So we want to centralize, that and support that as much as possible, this go around. So we're working through that, and again, we're looking forward to a more comprehensive update of the week. Possibly, I'm hoping by tomorrow, so that we can look back at the week, we can look back at the numbers, we can update, what's happened and what the results are that we're learning, and then we can position ourselves for the coming week. As part of that, I also want, our public to know what the thought process is, what we're looking at, what we're following to guide our decision making about, what's happening in schools. Next week, Director Arson Augustine and I are going to walk some schools. I invited him to join me because, in order to really kind of get a comfort level about what's happening at schools, or, to identify areas of improvement, it really is important to get out to the campus and see what's happening because these are not robots. These are not, we're not talking about inanimate objects. We're talking about children and employees operating in a relatively, hopefully close to normal school environment. And there are some things that are going to work perfectly, and there are some areas that are going to present some challenge. And those areas, we're going to work to find solutions to, and further supports to make sure we can address any areas that might still need to improve the protocols. But for now, we've got what we've gotten. I wouldn't say we expected to be at this place, but we did expect that if the numbers go up in the community, the risk of getting a case in school is going to be higher as well.
Right, yeah.
We have these cases, we're responding, we're waiting for the results. And based on those results, those will help drive us to, our next decisions.
Right.
You know,
Okay.
No, Dr. Ho was on and he was talking about the governor's supposed to be signing some executive order in the next couple of days, possibly over the weekend. Do you know if, or have you had any discussions with the governor's office about any restrictions or anything dealing with GDOE?
We have been in touch. I'll be honest, my recommendation was, we're waiting for data to come in. Let's base our decisions on the data. Let's not go day to day, week to week, operating without information. And so since we just opened, I said, the information is coming, right? It's if you're vaccinated, you're going to be you're recommended to test within 3 to 5 days. If you're unvaccinated, you're recommended to test between 5 to 7 days. We identified our first case on Monday, so we're going to need until at least this weekend, or hopefully, to start getting the bulk of our results back, so we can then proceed to understand what's happening with these cases. And again, once we get those results, we're going to be active in determining whether further action is needed or a change in direction is needed. But we really do need to base ourselves on what's actually happening, because if we just base it on what we fear is going to happen, that's a different level of discussion. That's really looking at the broader community, whether there is so much risk in the community outside of our school facilities that we have to close our schools because we fear that it'll enter our school grounds. At this point, we're not seeing spread of the virus within our school facilities, but we recognize that it is a fact of what's happening in terms of what's happening outside our school buildings.
I know we kind of touched on this before regarding concerns from parents and then wanting to pull their children out of face-to-face and wanting to switch online.
Hard copy or online or... Yeah.
Right. Are you getting more and more requests like that?
Well, we're getting a lot of requests from individual parents and students. Early on, if the school was able to accommodate those parents with those requests, they were able to do so. My understanding is that these online classes are maxed out now. So switching to online means that you would have to take a teacher out of a classroom and have them go online to support those students. And at this point, while we do have individuals requesting for online courses, we do have a large number of students coming to school daily for in-person instruction. So it's not possible to simply just shift every time we get a request. Now, again, if the risk assessment of a school gets to a point where we want to now shift more, in bulk, shift whole classes online and so forth, that becomes a little bit more feasible. But we can't. It's hard to do a student by student. You can imagine at a secondary level where you have 7 different teachers for your different content areas trying to switch over and trying to find out how to support that one student's needs. It's difficult and disruptive in terms of the fact that these teachers are in the classroom right now would have to switch gears, leaving the students in the classroom without instruction. So that's something that we're monitoring. We are actually gathering data on enrollment and attendance for this first week as well, so we can get a better handle on that situation versus the requests that are coming in case by case. And so once we get those numbers, we'll have a better sense of what our community is doing in terms of sending their kids to school versus keeping them home due to the fear of the virus.
Right. I don't know if it's anecdotal or not, John, but just at the school level, we're kind of tracking some chatter about parents who haven't even sent their kids to school yet. And I know that there's something about 3 days you miss school, they refer you over to the truant officer. What's the status of that?
I'm not gonna. What I'm gonna say is that there is a compulsory education law that requires parents to send their kids to school until the age of 18. So that's on the books. We do know that where we are today is vastly different from where we were last year, meaning we've got a significant amount of students who are back in the classroom, and we're working to keep them safe and again going through this situation. We are gathering the enrollment and the attendance numbers to get a better handle on who's not coming to school. And then, we're going to have to figure out how to address that situation. Our approach, of course, is to have some time to gather the data from this first round and assess the safety of our schools and convince parents that it is safe to send your kid to school, so that they can meet that legal requirement versus trying to penalize parents for obviously what may be of course heightened concern at this start of the school year. Our goal is to bring our kids back to school. We know that there are parents and students, maybe students who are not going to school yet or have been pulled out, at least temporarily. We're trying to track that information. But I think the real task is to determine whether we can continue to operate safely in school and, build confidence in parents who want to send their kids to school but are really anxious about what they're seeing in the community around the COVID-19 numbers.
I wanted to follow up on something. We had the public auditor on earlier this week, and he was talking about, he just kind of brought it up, about the masks that were given to students and how he had been receiving phone calls from parents about the masks that their children got, and some of them, they just don't fit. They're too big. They fall off their faces. And he was talking about, I might just have to do an audit, over on how GDOE is doing their procurement. Did you want to respond to that? I'm not sure.
Well, we always welcome the public auditors, partnership and looking at these things. I'm not aware of any procurement issues, but I do owe him a call. So thank you for reminding me. I do know that he did have concerns about, I guess he must have heard from somebody about the situation. I've been around schools and I've seen the masks, and I haven't, personally identified any issues of wearing the mask or difficulty, but I'm sure there are probably those instances out there, and it'll be important for us to make sure we address them. We did purchase both adult size for the larger students, older students, larger students, older students, as well as, kid size masks as well. So in a school where the mask is not, correctly sized, that should be addressed by the teacher and administrator without an issue, and we certainly have enough supplies to address that. So I'll give him a call and just find out which school he's talking about in particular. But for the most part, mask compliance has been really good amongst the kids and amongst the employees. We do have incidents here and there where we've had reports and we've had to address employees on campus to make sure they don't let their guard down. And everyone wants to take, when they're away from everybody, they might want to take a breather, but you're going to get caught on a photo and it's going to seem like you're doing this all day. Please be vigilant and make sure you abide by the requirements. We don't want anything like that, as isolated as it might be, to impact the confidence that our parents need to have in their schools. So we welcome that. We still have our email address that is taking a lot of concerns and comments at info@gdoe.net. So we're responding to the concerns, and some of those matters have been brought to my attention, and they get right to the principal to address, and they're addressed. So you're going to see that. I mean, just like you see in the broader community. I mean, especially when restrictions are still not yet tightened up. You see lots of parties and gatherings with people not.
Sometimes if you clap, it unfreezes.
Is it still frozen?
No,
there you go.
There you go. Oh, John, I wanted, while we're on the subject of masks, because we did get a tip in here, and I want to say it was Untalon, was a parent who had said that there was an incident involving a teacher who didn't wear the mask the whole day or something, and that teacher was sent down to downtown or reassigned. And then just, again, I had to go pick up something for my boy, and I get what you're saying, because it was after school hours. But when I came to the office, there were several employees who were just not wearing the mask because I feel like they probably, like you said, all day going to this thing. But given the spread of the community, right, it's those little gaps where it becomes a risk. So, have you had issues with teachers not wearing the mask? And then, are you doing any like circular department wide to just kind of remind everyone to remain vigilant?
Well, let me respond to it this way. They come to my office if they're not if they're not following the rules and they don't comply. I mean, it's one thing to maybe briefly do it and come back, and then comply when you're reminded and things like that. But if there's any resistance to it, and then we need to deal with that. So yes, when those incidents are identified, they come down here and they wear their masks.
Mm-hmm. Have you had any resistance or concerns that have been raised from some of your employees that aren't vaccinated and don't want to comply with the governor's mandate for mandatory vaccinations?
Yes, there are. I mean, there's concern, and there's for those who are unvaccinated. I mean, luckily for us, a vast majority of our employees are vaccinated. Fully vaccinated. So that's good news. So when it comes to the mandate, for us, it's really a matter of offering the opportunity for vaccination, encouraging, supporting our employees, and finding ways to answer their questions and address their concerns for those who might be on the fence. I mean, it's so hard when you're bombarded with all types of information.
Mm-hmm. There, John? There you go. John?
Sorry, are we back?
Yeah.
I guess I don't know if my camera has a timer on it or something, but yes, we want to inform, we want to educate and answer questions of our employees. I hate to get to a point where we got to talk about consequences, but that there is a mandate in place, and we want to make sure that everybody understands it's not a suggestion, it's a requirement that the governor has imposed, and I support it. I mean, I think that from everything I've read and learned, and that vaccinations are the most effective tool we have against the spread of the virus and the development of new variants. But for those who don't feel comfortable, we understand that too, and we want to do what we can to hopefully address their concerns and help them make that decision so that they can comply. Otherwise, there is that requirement for weekly testing and so forth. So if they're able to do that, then that's also another solution that we're working on.
Okay. Do you have any update on the HEPA filters?
Yes, I'm going to be focusing on what's going on there, but I know that we were supposed to already be in the stage of evaluating bids and awarding the filters so we can get them in. However, we did have a protest filed, and so we're reviewing that protest. Of course, very frustrating, but again, I understand that the vendors do have the right to protest if they feel that there needs to be an adjustment to allow for full competition. So I think one of the challenges in our procurement is that we want this as soon as possible, and so I think there is concern about the time frames and so forth for getting these the equipment on island. So of course it is an urgent situation and timing is important, but we certainly don't want the procurement to be tied up in protest, and not allowing us to move forward. So we're going to take a good look at it and decide how we want to proceed. But we do hope that these protests are done in good faith, so we can expedite the completion of this procurement and get the supports that we need into our classrooms.
Also, I wanted to follow up on this because somebody actually posted it earlier this morning when we went on our Facebook page, and people have messaged some of our reporters and myself wanting to know what is going on with the youth summer internship program and payments that haven't been made.
Yes, so very interesting. So, we have a summer internship program that's, we haven't had in the government for, gosh, over 2 decades. And it was wonderful to bring it back and to be able to support it and fund it. And what we did was we required submission of documents, including starting from the basics like timesheets, to account for the timesheets, and then also reflection papers, and then a final project that was due. And all of that had to be submitted as part of the completion of the internship. So depending on the agency, some were really, were good and just needed a few adjustments. Some of them submitted timesheets that basically just gave a total of hours and no further detail. But, with federally funded activities, we want to make sure that we don't have any risk of fraud or misuse of these dollars. So the scrutiny on the back end was quite extensive. And what we communicated was that we would push out, we have week 5 and week 6 payments that are due. So week 5 payments should be going out this morning. I think DYA was supposed to come here and pick up the available checks at 9 this morning, and then week 6 will be available next week. We're in the process of conducting a full audit of the program, so that any adjustments to the paychecks that need to be made can be made in that final payment, and to ensure that everything is above board. So we're getting a lot of concern, of course, from the agencies and organizations, and so we're trying to respond quickly. But I also know that we need to respond to some of those organizations that they still didn't submit what they were supposed to submit after several reminders. So we'll have to make sure that they get on board and do what's needed to what needs to be done in order to make sure that these kids get paid. We'll have to look at how we do this next year as well. I mean, one of the things is maybe streamline the process a little bit more, so we can ensure that we can do everything a little bit more timely. And then for organizations or agencies that really weren't able to be responsive in terms of what was needed to be done, they may not have as many interns or any interns next year, just because it'll simplify the process and ensure that we can use these federal funds without any question.
Right. John, just last question: are there teacher shortages at all? My kids haven't had Chamorro since the beginning of the school year, so I'm just wondering, are we?
Yeah, there. So right now there are teacher shortages, and again, there's a couple of things going on. I mean, first of all, there's always a teacher shortage, and a little bit, and in the Chamorro language area, a lot of retirements, a lot of teachers who had to really consider their ability to come.
All right. Good talk. There to go. Right on.
Your support. Right.
Sorry.
I want to thank you for your support, Jason. But like I said, there may be teachers, who have not come back because of the, fears of this COVID environment. It's been a tough year. We are working. We do have substitutes and teacher assistants that are going to be providing, some temporary coverage while we continue to hire for these positions.
Thank you, John.
Thanks, John. Appreciate
your time. Definitely. That was a long one.
Thank you.
Okay.
Thanks for the applause.
Unintentional.
All right, guys. Thanks.
Okay. See you.
Have a great
Stay
week.
safe.
All right. Hey, it's 9:24. Dr. Felix Cabrera.